Let's continue our journey about professionalism. Professionalism has many aspects like humanist ethics, critical thinking, teamwork, and communication. And now we will emphasize on communication skills, specifically doctor patient relationship. Doctor patient relationship is simply the interaction between doctor and patient that should be an open and clear communication in a comfortable environment. Doctor-patient relationship is fundamental for delivering excellent care, healing process, and improved outcomes. So it's very important to identify factors that affect this relation and those that make it good. Doctor-patient relationships are classified into types according to the doctor control and the patient control, whether high or low. Let's start with the first one in which doctor control is high and the patient control is low. It's called paternalism, and this is the traditional form in which the patient is completely passive and the doctor is the dominant part. This type has many advantages as it is more important when the patient is very sick and also relief of the patient from the burden of worry. This feeling itself is curative. And the most important advantage here is trusting the doctor. Trusting allows the doctor or gives him the opportunity to perform medical magic. But the disadvantage of this type is manipulation of vulnerable and ill patients. The second type occurs when the doctor control is high and also the patient control is high. It's called mutuality. This is the optimal model in which both bring strengths and resources for the relationship. The patient has the rule to define the problem in full manner and has the right to seek care elsewhere if the service is not satisfactory to him. The doctor has the rule to work together with the patient to define all aspects of the problem and has the right to withdraw the service if he feels that the patient's demand was not satisfactorily met. The advantage of this type is that the patient fully understands his problem and the doctor entirely knows his patient's values and being mutual making decisions more easier. But in case of bad communication, mutual understanding will not be met, and so making decisions will be very difficult. And this is the disadvantage of this type of doctor patient relationship. The third type occurs when the doctor control is low but the patient control is high. This is called consumerism. In this type, the patient takes the active role and the doctor is fairly passive. The patient is health shopper and he has the right to seek information and exercise independent judgment, while the doctor is only healthcare provider, technical consultant, and convinces the necessity of medical services. This type gives the patient the opportunity to have their own choices. But when the patient satisfaction is low or there is lower care or outcome than suspected, patients more likely question the physician's authority. The last type occurs when the doctor control is low and also the patient control is low, and this is called the default type, in which both the patient and the doctor expectations are at the odds. Our profession is to heal. In a patient encounter, we consider a right and good healing action for that patient in his or her particular circumstances. Clinical judgment consists of three steps. The first one is a diagnostic question. What's wrong with this patient? Considering the patient's medical history, physical examination, laboratory test results, and other data. The second one is a therapeutic question. What can be done for this patient, which is frequently informed by the scientific evidence and which comprises the array of treatments that might help the patient. The last one is the prudential question. What should be done for this patient, which clearly needs to involve the patient to determine the option that will work best. Finally, doctors has professional responsibilities like maintaining professional competence, honesty with patients, respect patient confidentiality, maintain appropriate relations with patients, improve quality of care, improve access to care, promote just distribution of definite resources, advance scientific knowledge, maintain trust by managing conflict of interest, and finally, fulfill these professional responsibilities. Thank you, my dear colleagues, hoping you enjoyed our journey.